Next, we'll hear from Jerry Vogel with a presentation from 21st Century Dentistry. Now, he'll have also a second presentation, and it'll be on the newest offerings from Panthera Dental. Jerry.
So my name is Jerry Vogel, and I'm with 21st Century Dentistry. It's the name of the company, and it's also the topic of what we're discussing right now. How things have changed, and how do we maximize the things that are out there to get the ultimate patient satisfaction. So, 21st century, nothing has changed except everything. We were in a meeting and we were coming up with some of the new products and the developments that you'll see in a little bit. And we're saying, so, what's really different? Because the bottom line is the patient, they're going to look at everything that you do by going like this. They want to see how that looks. But we have intraoral scanners, we have CT scans, we have caries detectors. We've changed everything, or the way that we've done everything, but for the patient, not that much has changed. So I'm going to introduce you all today to how do we take some of the elementary things that we use, our telephone, the IT systems that we use within our office, how do we maximize them to create the best patient experience and at the same time increase revenue for the practice. So it starts with the most elementary of all, and that is the telephone. So the telephone, we have a program called Rapid Rev, and a Rapid Rev gives the ultimate patient experience, whereby when a patient calls in, and I'll show you some of this in a little bit, a patient calls in, you have all of their information for you to capture the most extreme opportunity you can from them. For instance, there's inbound and outbound aspects of this. So on the inbound call, when a patient calls, so if I was calling my dentist, it would say Jerry Vogel, and it would give all the information what's going on for me, where my insurance rate stays. It would talk about what plans are being worked on with me, what appointments have I missed, am I due for hygiene. It has my family, and if any of them have any outstanding things, it'll show a red flag that'll it'll tell the person at the answering the phone that they have an action that they should be taking on this patient. Same thing with the outbound. I mean, how many hours are spent for people calling, doing the reminder, saying, please come in? Well, the way this system works is that if you get an answering machine, the device actually will leave a pre-recorded message. It can be from the doctor, from the hygienist, whoever it is that you want it to do, and it automatically dials to the next patient on your list, so that the only time that you're speaking on the phone is when, in fact, you are speaking directly to somebody. So it increases productivity by about 4%. But let's take a look. So this is your screen. A call comes in from Andrew, our patient. This is the main screen. And when it comes up, so I get Andrew's picture in that yellow box, which I'll go into in 1 second. It talks about all of the red flags that are out there and things that we should capture for that patient. So now the patient is having a much better experience to start his time with your practice. They know, he feels now that you know everything that he is doing, that what treatment plans he's doing, has he had his hygiene, and his family members as well. You'll see on the left side that there is actually family names there, and if they had things that were outstanding, there would be red flags on there. We also show, is this person, responding to emails, phones, etc., and so on. So we have checkbox to make sure that we are maxing them. So we'll drill in a little bit to the box that we showed on what information are you actually getting on Andrew when he calls in. So he has an unscheduled recare. He's doing periodontal maintenance, and he hasn't followed up on his call. So you're trying to get him into the office to capture that opportunity and to optimize his care. Same thing, it gives you the amount that is past due. So it's a great accounting tool as well, so you can remind them, hey, just a reminder, you're there, you owe X amount of dollars. If you can make a payment, we'd be most grateful. This taps into the insurance information as well. So if there's deductible money that's left within their insurance plan, it'll tell you that, how much they've used, how much they have left, and you can run campaigns actually to go after them to say, hey, you still have insurance money left if you'd like to come in.